There are two risk factors for lung cancer. First, non-modifiable. Non-modifiable means the characteristic or behaviors that increase the likelihood of developing a disease or health condition that cannot be changed or controlled. The second one is modifiable, the characteristic or behavior that increase the likelihood of developing a disease or health condition that can be changed or controlled. There are several examples for non-modifiable risk factor. First, age. Biological aging can cause metabolite NAD+ levels drop, telomeres shorten, and cells lose their capacity to tolerate and repair DNA damage. Second, gender. Do you know the most significant contributing to gender disparity is that male are more prone to use tobacco than female. The last one is family history. Variants in some chromosomal areas have been linked to an increased risk of lung cancer according to genome-wide association studies. For example, 15q2526. It is linked to lung cancer susceptibility. There are few examples for modifiable risk factors. First, smoking. The combustion of tobacco produces over 16 known carcinogens, polycyclic aromatic hydrocarbon, and nitrous amines. It induces DNA damage and mutations that increase the risk of carcinogenesis. The second one is asbestos. Asbestos is mineral that is utilized in building because of its flame retardant qualities. Asbestos fibers can trap tobacco particles, contributing to the link between tobacco smoking and lung cancer. The third one is air pollution. Carbon monoxide is emitted by vehicles and factories and is regarded as silent killer. It is due to its ability to bind hemoglobin more strongly than oxygen, increasing the risk of asphyxia, related death at high levels of exposure and contributing to lung cancer. The fourth one is chronic obstructive pulmonary disease or COPD. COPD-related inflammation and scarring are independently linked to a higher risk of developing lung cancer. Due to increased oxidative damage to DNA, prolonged exposure to inflammatory cytokines, suppression of DNA repair systems, and increased cell proliferation. The last one is infection. Inflammation and cellular damage during respiratory infection have been linked to lung cancer development. A meta-analysis found that tuberculosis, the biggest infection cause of mortality globally, has a 1.76 odds ratio for developing lung cancer.
Now, let's jump into the sample of real cases of lung cancer. The first case is a 26-year-old man presented with a 3-month history of chest pain, facial swelling, lumps within his axilla, and weight loss. CT-guided biopsy of the mediastinal mass was performed. The histology results was small cell lung cancer. Based on the patient's story, he began smoking cannabis at the age of 14 years old. Between the age of 18 and 24 years, his cannabis consumption increased to 8 joints daily. The patient decided to source private treatment in Mexico after being informed that there were no further conventional treatments available and that priority would be symptom control. Unfortunately, the disease again progressed through treatment, and the patient told to be died on return to UK after this course of chemotherapy in Mexico. Time of survival of this patient from diagnosis was 2 years and 16 days. The second case is a 55-year-old male. This patient does not have any medical history, plus he is a non-smoker but has been diagnosed with lung cancer due to occasional exposure to industrial chemical. The symptoms that this patient faces is persistent hoarseness, difficulty swallowing, and worsening shortness of breath. From CT scan, it shows a large mass in the upper lobe, mediastinal lymph node enlargement, and involvement of the left main bronchus. Specialist doctor diagnosed this patient as stage 3A non-small lung cancer, squamous cell carcinoma. The patient showed a significant reduction in tumor size after initial treatment. Surgical resection was performed on the tumor. However, a recurrence was detected after 18 months and the patient underwent additional chemotherapy and radiation.
We have talked about what are the factors and cases regarding the lung cancer, but what about the signs and symptoms for the lung cancer? The common symptoms are coughing. If you have been coughing non-stop for the last 3 weeks or coughing up blood, you might have cancer due to the tumor in your airway. Second, fatigue. You are constantly feeling tired and it does not improve with resting. Third, shortness of breath. Being easily winded means your airways are blocked or fluids in the lungs. Fourth, chest pain due to coughing a lot and the pain gets worse when cough or inhale. Fifth, appetite loss due to vomiting or nausea and changes in sense of taste or smell. 6. Weight loss due to difficulty of swallowing and your body not being able to absorb nutrients from food. Next, signs and less common symptoms, which are finger clubbing. It is a bulging fingertips. 80% of people with finger clubbing have lung cancer, sometimes called club finger or digital clubbing. Persistent or recurring chest infection. Recurring pattern might indicate lung tumor blocking your airway. Wheezing. Airway of lung become blocked or constricted. You might be wheezing or whistling when breathe. Lastly, lumps and bumps. Cancer spread through lymph nodes which cause swelling of your face or neck.
Treatments for lung cancer depend on various factors like stage, overall health, and non-small cell lung cancer or small cell lung cancer. Surgical treatments best for early stage of cancer where the cancer has not spread. The cornerstone treatment for early stage non-small cell lung cancer and could be an integral part of a multimodal treatment plan for advanced stage cancer with innovative therapies. Next, immunotherapy. Therapies targeting cytotoxic T cells and programmed cell death to boost the immune system. Other than that, radiotherapy allows measurement of patient-specific tumor motion which can be incorporated into radiotherapy plans. It kills cancer cells using high-energy rays. Besides that, chemotherapy. Chemotherapeutic agents manage advanced diseases. Drugs usage to kill cancer cells in the body. Moreover, clinical trials, participation in trials for new therapies or drugs for advanced treatment of lung cancer in the future. Lastly, supportive care relieves the symptoms and improves quality of life including provide oxygen therapy, medication or cardiorespiratory fitness.